everybody, Dr. Rayford from Vet Triage. We are continuing through this issue of veterinary surgery from 2022. We are talking about the development of ventricular fibrillation as a complication of pericardiectomy in 16 dogs. The study comes out of University of California, the University of Oregon, a veterinary hospital in Australia, another hospital in Italy, hospital in Taiwan, school in Missouri, school in Iowa, school in Ontario, Wisconsin, Minnesota. Let's see here. Objective is to describe the clinical characteristics, perioperative protocols, and outcomes in dogs diagnosed with ventricular fibrillation while undergoing pericardiectomy. Retrospective study, 16 dogs. Right off the bat, you can tell 16 dogs, not a lot at all. Retrospective, we know there's always issues with those. Dogs were included if they developed ventricular fibrillation during a pericardiectomy performed either through open or thoracoscopic approach. Results, indications for pericardiectomy include idiopathic chylothorax most often, followed by cancer, then idiopathic, and then foreign body. Surgical approaches include thoracoscopy, which is the majority, otherwise intercostal thoracotomy and median sternotomy. Electrosurgical devices were used to complete at least part of the pericardiectomy in 15 out of 16 dogs. Ventricular fibrillation appeared to be initiated during electrosurgical use in 8 out of 15 dogs, so almost 50%. However, in 5 out of 15 dogs, so 30%, it was not obviously associated with electrosurgical use. In 3 out of 16 dogs, the timing of initiation of ventricular fibrillation was unclear. In 7 out of 16, cardiac arrhythmias were noted before developing ventricular fibrillation. 14 of 16 dogs died from intraoperative ventricular fibrillation. Conclusion, in most dogs, ventricular fibrillation was fatal. Ventricular fibrillation may be associated with electrosurgical devices and cardiac manipulation, but they could not establish that link in this study. All right, introduction. Surgical removal of the pericardium, very common. You might use it for chylothorax, right atrial hemangiosarcoma, chemodectoma, mesothelioma, coagulopathies, fungal, and septic pericarditis. The goal of the surgery is to resect diseased tissue, harvest samples for biopsy, relieve cardiac tamponade that can develop as fluid accumulates in the pericardium and restricts normal chamber expansion. With chylothorax, it has been postulated that impaired diastolic filling from a fibrosed and thickened or constrictive pericardium can lead to central venous hypertension, which in turn could lead to lymphatic hypertension and chyle leakage. Complications include hemorrhage, iatrogenic nerve or lung damage, and cardiac arrhythmias. Ventricular fibrillation is a condition characterized by turbulent cellular electrical activity resulting in mechanical incoordination and subsequent pump failure. Broad causes can be categorized as cardiac or non-cardiac, including structural cardiac disease, hypoxemia, electrolytes, neurologic disease, various surgical diseases, and physical electrical manipulation. Immediate treatment is aimed at defibrillation, antiarrhythmic medications, and addressing any predisposing conditions. Results: 16 dogs between 2004 to 2020. Mostly spayed females, median age 9 years, median weight 28 kilograms. Most common clinical signs: exercise intolerance, followed by lethargy, dyspnea, physical examination, weight loss, pale gums, and so forth. Here is a chart for those who want all 16 dogs. You can pause the video and zoom in there if you'd like that information. Let's see. Laboratory evaluation and diagnostic imaging. Thoracic radiographs most often showed pleural effusion and then other things. Abdominal ultrasound, most often ascites. Contrast enhanced computed tomography, most often chylothorax. Echocardiogram, most often pericardial effusion, followed by a mass, and so forth. Pericardiocentesis, median volume of fluid removed from pericardial sac is 150 mLs. Hemorrhagic effusion most often, followed by neoplastic epithelial cells. Chylothorax, with triglyceride levels, median serum and pleural effusion triglycerides was 56.5 mg per dl and 1,441 mg per dl, respectively. And then regarding anesthesia and surgery, thoracoscopy, 12 out of 16. Right fifth intercostal thoracotomy, 2 out of 16 dogs. Right 10th intercostal thoracotomy, 1 out of 16. Median sternotomy, 1 out of 16. And 13 out of 16 dogs, they were in dorsal recumbency. Of 13 scoping procedures, 12 used a 3-pore technique. The following abnormalities were found during surgery, most often pleural and pericardial thickening and fibrosis. Pericardiectomy was initiated with scissors in 9 out of 16 cases and with an electrosurgical device in 7 out of 16. Electrosurgical units were used to perform at least part of the pericardiectomy procedure in 15 out of 16 dogs. Ligature or forced triad generators were used in 12 dogs, and the Ensealed Gen 11 generator in 2 dogs. Procedures performed prior to pericardiectomy under the same anesthesia was thoracic duct ligation, mass resection, and so forth. Ventricular fibrillation events and treatment. In 7 out of 16 dogs, cardiac arrhythmias were noted prior to the development of ventricular fibrillation, including ventricular premature complexes, ventricular tachycardia, and sinus bradycardia. So there might be some warning signs before developing ventricular fibrillation in these dogs. Let's charge the computer. Let's see here. Rescue medications, procedures include vasopressors, antiarrhythmia, reversal agents, cardiac compressions, defibrillation, converting to open approach. Median anesthetic time, 203 minutes. Median surgical time, 73 minutes. Histopathology showed lymphoplasmacytic and fibrinous pericarditis with chronic hemorrhage, and then proliferative proliferative serositis with lymphosuppurative inflammation and chemodectoma. The incidence of ventricular fibrillation during pericardiectomy, during the study period, total number of pericardiectomies performed at the institutions were 456. So that made the incidence of ventricular fibrillation at 3%. The outcome, 14 out of 16 dogs died. Discussion. Ventricular fibrillation is found to be rare and fatal. It is possible that electrosurgical devices and cardiac manipulation has something to do with it, but they couldn't make the link. Number of factors associated with cardiac arrhythmias in people include electrolyte or acid-base derangements, fluid imbalances, medications, physical manipulation of the cardiac tissue, and using electrosurgical devices, as well as the severity of underlying pericardial disease and structural cardiac disease, conduction disturbances, hypertension, pulmonic or endocrine diseases. It's possible that primary, secondary heart disease went underdiagnosed in these dogs. Examples in people that suffer ventricular fibrillation include QT syndrome and Takotsubo cardiomyopathy. That's TAKOTSUBO. And then myocarditis and myocardial ischemic injury are also plausible. Physical handling of the pericardial and cardiac tissue may contribute. Surgical manipulation of parasympathetic and sympathetic cardiac innervation, including vagus nerve, sympathetic ganglia, could affect vagal tone and autonomic balance. Predisposing of pressure receptors in the aortic arch or cardiac chambers, which can alter the complex pressure-volume relationship that governs electrical conduction and cardiac function. Human publications have supported a link demonstrating that specific surgical approaches and more extensive procedures can impact arrhythmias. In human case descriptions, an association between the use of electrosurgery and development of operative ventricular fibrillation has been suggested during pericardiectomy, but also a plethora of other procedures, including bilateral mastectomy, resection of liver masses, lung masses, hemorrhage from esophagectomy, gastric banding procedure. Monopolar electrosurgery was implicated in all human cases, whereas both bipolar and monopolar were employed in dogs that developed ventricular fibrillation. 3 distinct mechanisms of electrosurgical induction of ventricular fibrillation have been established. So these are things you might want to know for like boards. These can be separated based on the magnitude and duration of the current applied in each. The first example involves a single high current stimulus during the T wave of the cardiac cycle. This phenomenon is a result of the relative and absolute refractory nature of cardiac myocytes to electrical stimulation during the repolarization period during the T wave, A shock during this period can alter the rhythm and result in ventricular fibrillation. The second mechanism is a result of multiple electrical pulses of a lower current applied over 1 to 5 seconds to epicardial cells. These cells demonstrate variability in the repolarization capabilities and refractory properties. The inherent heterogeneity within the cell population leads to a discordant response to electrical signaling, inducing a brief period of profound tachycardia over 450 beats per minute. Wow, it's like what's more than a bird. And potentially ventricular fibrillation. The final mechanism involves an even lower current applied over 90 to 300 seconds, which also causes an increase in heart rate. Greater than 220 beats per minute decreases the diastolic filling time, which induces myocardial ischemia due to reduced cardiac output. The resulting ischemia directly lowers the intrinsic ventricular fibrillation threshold, thereby increasing the likelihood. It is difficult to hypothesize which of these mechanisms, if any, could have played a role in these dogs where electrosurgical energy was used, and its use appears subjectively to occur with the onset of ventricular fibrillation. Frequency of most electrosurgical units is 200 kilohertz to 3.3 megahertz, which is greater than the 50 to 60 hertz range in which cardiac myocytes respond. However, in rare exceptions, low frequency stray current can result from the use of electrosurgical and cause pathologic excitation of cardiac cells. This phenomenon can occur with the use of both monopolar and bipolar devices, although the frequency varies depending on the type and mode of use and its relationship with surrounding tissues. The monopolar cut function is characterized by a use of continuous current, which allows for lower voltage requirements to achieve a given amount of power or watts. Reductions in voltage decrease the size of the surrounding area susceptible to inadvertent low-level stray currents, thereby mitigating the potential for unexpected pathologic cellular excitation. Similarly, bipolar technology decreases the risk of causing low-frequency stray currents to travel through the regional tissues. However, this is due to the location of the return electrode. Specifically, the orientation of two electrodes relative to the tissues of interest restricts the current to that region. This reduces the risk of adverse sequelae caused by low-frequency stray current, as the electrical pathway does not travel through the patient. These two functions can be contrasted with monopolar coagulation mode, which employs an interrupted current at higher voltages. These parameters predispose the tissues to more collateral damage, including transmission of low-level stray current. The overall survival was poor, 2 out of 16. Decreased time, internal compression like cardiac massage technique, and application of defibrillator leads directly onto the heart are associated with improved survival. Approximately 3% of dogs undergoing pericardiectomy developed ventricular fibrillation. Alterations in the patient's hemodynamic status or electrolytes should be corrected prior to anesthesia, and protocols should avoid arrhythmogenic medications. Pre-op and peri-op antifibrillatory medications like amlodipine and sotalol might also be considered for some cases. Theoretical surgical considerations include the use of bipolar as opposed to monopolar devices, specifically coagulation mode, or alternatively the use of harmonic scalpel, as it avoids electrosurgical technology entirely. If a monopolar device is used, periods of application should be limited to short duration, less than 5 seconds, with the cut as opposed to the coagulation function employed whenever possible. All devices should be employed at the lowest power watts settings regardless of the mode of use. You want to have ECG monitoring, as ECG rhythm disturbances were documented before the development of ventricular fibrillation, include ventricular premature complexes, ventricular tachycardia, and sinus bradycardia. So it's an interesting case. I've performed a number of pericardiectomies. I haven't seen this complication, and I've always used bipolar devices for it and scissors. Anyway, for veterinarians, just be aware that if you perform this procedure, that ventricular fibrillation is a possibility. And luckily, it's not common, but unfortunately, when it does happen, it's invariably fatal. All right, guys, we'll see you again in the next video. Thanks so much.